Welcome to the morning edition of Intense Issues News. I'm Ronald Burgundy, and today we're in San Diego.
I'm Veronica Corningstone. Our intense issue for today is healthcare reform in the state.
Today, Veronica and I will debate this issue. Don't worry, we are both on medication.
Ron is against this issue, and I am for it.
You know, Veronica, nothing is free when it comes to a government program. Free healthcare is a misstatement. It's not really free since we must pay for it with taxes, and already 84.7% of the population is covered.
Well, but the number of uninsured citizens has grown to over 45 million.
Well, who else is part of that 45 million? Illegal immigrants. That's who.
Well, they're people too.
They're people that are here legally, and excuse me for not wanting to pay for them. And we're back with Intense Issues News. If too many people go with the public option, the government is more likely to put restrictions and higher taxes on fast food and other unhealthy activities, leading to a loss of civil liberties for everyone.
But those who are uninsured have a 25% higher mortality rate than those who are insured.
Just because Americans are uninsured doesn't mean they can't receive health care. Nonprofits and government-run hospitals provide services to those who don't have insurance. It is illegal to refuse emergency service because of lack of insurance.
Watch this excerpt of President Obama's weekly address on July 18th, 2009.
Okay, so we're here with this random person who happens to be in our kitchen and who happens to be my mother. But since this is a formal setting, I will refer to her as Rhonda. So Rhonda, I wanted to get your view on this whole healthcare debate we're having in this country. It's a very serious issue for many Americans, and it makes many of them angry. It makes many of them support it, but I wanted to get your view on this. So what type of insurance do you currently have now in this system?
Well, I am a teacher, and we are lucky enough to be in one of, I think, only 3 districts in our county that still provides 100% health insurance. So it's board paid, but it is part of my salary.
Yes.
So in essence,
So you're paying for it.
I'm paying for it because
Okay.
it's part of my salary.
And
So I have HealthLink, and then my 2 children are also on HealthLink with my insurance through my work. And then my husband, Mark, has Blue Cross and Blue Shield.
okay,
And he pays for his insurance independently.
okay,
It's not provided by his employer.
okay. So he's just completely independent with his costs. His employer doesn't
Well,
assist?
actually, he was insured through his work, and they paid for his health insurance. But then the cost got so expensive that they couldn't afford it anymore. So what they do is they pay up to I believe it's $300 a month. So he has health care independently that he pays for, and then they reimburse him I believe it's $300 a month.
So
So it's part of his salary too.
okay. So in essence, he's paying for
He's
it.
paying for it too.
So how much per person do you think you spend on health insurance?
Well, my health insurance is approximately $400 a month, and my two children together, theirs is like $355 a month, and then my husband's insurance is $416 a month.
Okay, so that comes out to $1,071 a month, and so that turns out to $14,000 a year. So you agree that we need some sort of health care reform in this country?
Absolutely.
That is obviously too much for
Absolutely.
a family of 4.
Yes, because if I was a single parent, there is no way that I could pay for my health insurance and my 2 children's health insurance, because it would be like, I think I figured it up, like 18% of my salary.
Yes.
And there's no way that I could afford that.
Yes. So thank God for old Marcus here. So how much, have you ever been declined health care in this country?
No, I haven't. Thankfully, we are very healthy,
Yes.
so we don't have any pre-existing conditions that keeps us from getting health care.
No. Yes. Have you ever been out of this country and received health care?
No, thank God.
Yes.
You know, I did have one issue, though. When I had my first child, I was covered. I had health coverage, but the insurance company refused to pay part of the bill for the delivery of my baby because they said it was too high for this area.
And so, did Dad call the doctor or
Oh,
something?
yes, he was irate. So he called, it was in Cape. I had,
Like, buddy, I will get you fired.
you were delivered in Cape. It was you when you were born. And so he called up and talked to the billing person at because it was the doctor's charge, not the hospital, the doctor's charge, and just told him that he would refuse to pay it because if it was, it wasn't like we had gone to the Mayo Clinic, it was Cape Girardeau, Missouri, and if they were charging too much for the insurance to pay, he was not going to pay it. It was like $200, and he refused to pay it, and that's the last we heard.
Okay, do you agree with the current health care reform bill that is passing through Congress?
Well, I really don't know that much about it because on the news it seems like all they talk about is just how long and involved it is, like 2,000 pages.
2,000 pages.
And I don't really think anyone knows very much about what's in the bill, our congressman or the president, either one. It's just
What a fine man
too
he
involved.
is. So, what would you do to fix our system?
Well, I think the best thing to do would be to open up our state lines so we would have competition between different insurance companies because that's always worked in our past. Competition keeps prices low, and I think that would be the first step to fixing it.
So, what do you say to people who say that that government programs, have worked and that like people that say, government is a good thing? Do you agree with that statement?
No, I think less government the better, because government programs a lot of times tend to be corrupt. And just take Social Security, for instance. I think that's a wonderful program. And it's done great things, I think, for our country. But because the government has been stealing money out of it now, it's going to be, that's right, it's going to be broke. Probably by the time, hopefully, my husband will get to draw some of his. But if something's not done, that's going to be broke. And then all of these people that have paid into it all of these years are not going to have any Social Security retirement money.
Do you know anyone who has had trouble with the current system?
I do. My brother-in-law, who happens to be a smoker, and
extremely overweight.
And he's overweight. So he was able to get health insurance, but it was $900 a month.
$900 a month?
$900 a month. And finally, his wife heard about some kind of program that is offered. I'm not sure if it's through the insurance companies or if it's a government program, but it's reduced the cost of his down to, I'm thinking, around $400 a month.
Okay. Do you think there are any perils in a government-run system, like any hardships or any problems that we might run into if we would happen to go on a government run?
I think probably we would have definitely have increased wait time to get into the doctor or to have surgeries done. And it's bad enough as it is to try to get in, especially in this part of the country. I think we just have a shortage of doctors. And I'm afraid that would make that even worse. And if you have something that's serious, it could be life-threatening.
What's the, even though it is expensive, is the quality good through your current health care insurance provider? Like, does it cover everything? And is the health care you receive through your insurance provider of good quality?
I think it is. I mean, I'm happy with it. Besides the cost of it, it pays for routine screenings. So, like mammograms are paid for. Yearly checkups are